Your body changed last week, and the week before that, and the week before that. And there's a very good chance you noticed and decided it was nothing. Most of the time you're right, but sometimes, and this is the part I need you to hear, sometimes that small change you brushed off is your body trying to show you something serious. Something that, if caught right now, is completely treatable, but if ignored for another 6 months, becomes a very different conversation. Today, I'm going to walk you through 7 body changes that people over 50 should never ever ignore. Not to frighten you, but because knowing the difference between this is fine and this needs attention, that knowledge is the difference between catching something early and wishing you had. Stay with me for the whole video, because I promise you, at least one of these will make you think about something you've been pushing to the back of your mind. Here is the hardest truth about health after 50. The human body is extraordinarily good at compensating. When something starts going wrong, it doesn't immediately shut down, and it adapts. It works around the problem. It finds a way to keep functioning. And because it's so good at this, the early warning signs of serious disease are often subtle, easy to rationalize, easy to wait on. We have a very natural tendency, especially in this generation, to push through, to not complain, to assume that if it were really serious, it would hurt more. We were raised to be tough, and that toughness has served us well in many ways. But when it comes to the body's early warning signals, that same toughness can work against us. The conditions that are most treatable: early cancer, early heart disease, early diabetes, early neurological changes, they announce themselves quietly. A small lump, a subtle change in vision, a shift in how you move or think, something just a little bit off. Those quiet signals are precious. They are the window when intervention works best, when outcomes are most hopeful, when you still have the most choices. This video is about learning to recognize those signals before that window closes. Let's start with something you can see with your own eyes. Right now, if you look, most of us have freckles, moles, or small skin spots that have been part of us for years. We know them. We don't think about them. But skin cancer, including the most dangerous kind called melanoma, often doesn't start as something dramatic. It starts as a small change to something that was already there. A mole that slowly gets bigger. One that used to be round and is now uneven around the edges. A spot that has 2 or 3 different shades of brown or black in it. A mark that starts bleeding or itching without being scratched. Think about a 71-year-old woman who had a small mole on her shoulder for 20 years. Then one summer she noticed it seemed a little bigger, a little darker on one side. She almost didn't mention it at her annual physical, but she did, almost as an afterthought. Her doctor looked at it and immediately sent her to a specialist. It was early melanoma, caught at the very first stage, completely removed. She is perfectly healthy today. Had she waited another year, and she almost did, the story might have been very different. What you can do: once a month, do a simple skin check. Use a mirror to look at your back and shoulders. Look at your scalp. Check the soles of your feet. You're looking for anything new, anything that changed, anything that looks different from the last time you looked. If something catches your eye, don't wait. A dermatologist can tell you in minutes whether it's concerning. This one almost nobody talks about, and it absolutely deserves more attention. If your voice has become hoarse, raspy, or noticeably weaker, and it's been that way for more than 3 weeks without a clear reason like a cold or allergies, that is something to bring to a doctor. Persistent change in the voice can be a sign of thyroid problems, since the thyroid sits right next to the voice box and can affect it when it's enlarged or developing a nodule. It can also be an early indicator of cancer in the throat, larynx, or esophagus, all of which are highly treatable when caught early. Acid reflux, when it's severe and chronic, can also damage the voice box over time. And if that's what's causing the change, getting it treated protects far more than just your voice. People often assume a raspy voice is just from talking too much or a little post-nasal drip, and maybe it is. But a voice change that simply doesn't resolve after several weeks is worth a conversation with your doctor. Not a panicked emergency visit, just a conversation. Here is a change that people almost universally normalize, and shouldn't. As we age, swallowing can become slightly less effortless. But there is a meaningful difference between occasionally needing an extra sip of water with a meal and a progressive, worsening difficulty getting food or liquid down, if food feels like it sticks in your chest or throat. If you find yourself avoiding certain foods because they're hard to swallow, if swallowing has become uncomfortable, or if you've lost weight because eating feels difficult, these are signs that something may be changing in the esophagus, the tube that carries food from your mouth to your stomach. Esophageal cancer is one of the most survivable cancers when found early, and one of the most difficult to treat when found late. Difficulty swallowing is often its first and clearest warning sign. Swallowing trouble can also signal GERD, a hiatal hernia, or neurological changes, all of which are important to diagnose and manage. What you can do. If swallowing has become regularly uncomfortable or difficult, tell your doctor. A simple scope procedure can look at the esophagus directly and give a clear picture of what's happening. Don't let embarrassment or the assumption that it's just how I eat now get in the way. This one is deeply personal for many people, because losing balance or stability feels like an admission that the body is slowing down, and most people don't want to face that. But listen carefully. A change in your gait, the way you walk, or a new difficulty with balance is one of the most important changes to bring to a doctor because it can come from so many different places. It can be a sign of early Parkinson's disease, which is far more manageable when treatment begins early. It can indicate a neurological change in the brain or spine. It can be connected to inner ear problems, to vitamin deficiencies, especially B12, or to medication side effects that are completely reversible with a simple adjustment. It can also be a lingering effect of a small, silent stroke that you may not have even known you had. Picture a 65-year-old man who noticed he had to concentrate more to walk a straight line. His stride had gotten a little shuffled. He assumed it was his knee. His son noticed it too, but didn't want to say anything. When he finally brought it up with his doctor, an MRI revealed early changes in the brain's movement center, and early treatment made a significant difference in his quality of life. A change in how you walk is not something to silently manage. It's something to investigate. Your balance is worth protecting with everything you have. This is perhaps the most important change on this entire list, and I need you to hear it clearly. Blood in your urine, even just once, even just a small amount, even if it only happened one time and went away, needs to be evaluated. Full stop. Blood in your stool, whether it appears bright red, or whether your stool has become dark and tarry in color, needs to be evaluated. Coughing up blood, or noticing blood when you blow your nose regularly, or bleeding from the gums that's new and persistent, these all need to be evaluated. There are benign explanations for all of these. Hemorrhoids, a urinary tract infection, a broken blood vessel from a strong cough. And often that's exactly what it is. But blood appearing where it shouldn't, especially for the first time, especially after 50, is one of the body's most direct ways of signaling that something needs attention. Bladder cancer, kidney cancer, colon cancer, they often announce themselves first through bleeding. And all of them, caught early, are among the most treatable cancers there are. Please do not wait for it to happen again before you call. Please do not decide it was nothing without letting a doctor confirm that. One visit, one question. That's all it takes. Most of us have felt bloated after a big meal. That's normal. That goes away. What I'm talking about here is different. A persistent bloating that has lasted weeks. A feeling of fullness or pressure in your abdomen that is just always there, at a low level. An abdomen that feels harder or more distended than it used to, especially on one side. In women, this pattern is one of the most consistent early signs of ovarian cancer, and ovarian cancer is called a silent disease precisely because its early signs are so easy to mistake for digestive discomfort. The women who catch it early are often the ones who trusted that something was off, even when the disc